Well, my name is Sara. I'm a retired architect. My current project to get out of the way before I die is to get all the family archives in binders documented. There's a scrap of Andrew Jackson's wife's dress. This letter here was actually written during the Civil War on the battlefield. The biggest thing I've gotten out of it is through all these letters from people from the 1800s to the 1900s is how much my family loved each other. I was multitasking. I saw a blanket that needed to be put away. I had the blanket in my hands and I stepped up on the stool, and the next thing I knew, I was on the ground in pain and my hand was over here and my arm was over here. In the hospital, after they had reset it, I'd been there for a few hours, and the doctor eventually came back and said, we've done the best we can, but we know you're going to have surgery. I looked up orthopedists in the Denver area and came across Panorama.
I'm Lodha. I'm one of the orthopedic surgeons here at Panorama Hand Center, specializing in hand surgery.
I fractured my radius, which is this bone, and I chipped off the end of the ulna over here. Dr. Lodha stood out to me because he went to Duke, he went to Harvard, he was young and obviously well educated, and from my thinking would be versed in all the latest technology and the latest and all that. So he's the one I set up an appointment with, and I was very, very happy about it.
She presented with what was a fairly significantly displaced distal radius fracture. It was bent backwards and does put her at significant risk for developing tendon injury or nerve injury if it hadn't been treated appropriately. This is her fracture after it was repaired. So what we do is we place a plate on the front or the palmar part of the bone with multiple screws that attach both to the part of the bone that's intact and to the area that was fractured, and reestablish the normal anatomic relationship of the bone. When we look at the side view and you contrast it with the view that we saw earlier, you can now see that we've restored the normal anatomy of the bone with this nice even contour, whereas here you had that nearly 90-degree backwards angle.
My experience with Panorama was unbelievable. I just really enjoyed Dr. Lodha and his assistant Sandy, and actually the whole staff there at Panorama, making me feel comfortable, and that they really cared about me and really cared about my hand. It's just a little thin mark where the surgery was. So it was just really well done, that's all I can say.
So our goal in operative stabilization is to A, get the fracture back into anatomic position so that we limit the risk of any long-term deformity or development of arthritis, and B, we provide very stable fixation so that they can get their function back quickly.
It will all come back. All my feeling, everything I've had before will come back. It's 90% there, and it's only been 2.5 months.
Part of what I think makes us a little bit different here at Panorama is that we see a tremendous volume of trauma here. So between the 3 hand surgeons, we see an enormous number of wrist fractures that we're treating pretty much on a weekly basis. That volume gives us a lot of expertise in surgically attending to these fractures. We can do it with a lot less trauma to the neighboring soft tissue structures. We can get them in and out of the operating room fairly quickly, and we can do what is technically a good job in terms of restoring the normal anatomy of the bone. I think all of those 3 things together allow patients to recover a lot faster than they would otherwise.